thank you all so much for being a part of this, and I really appreciate all the speakers before me. If I could just share a few things, I appreciate the individual, I'll use the word stories, but these are real people, real life events, real life experiences. But I appreciate those individual stories and references to the issues within the healthcare system itself. And there's so many more things. But I want to make a preface, if you will, to acknowledge, take into account that this is all in a context of the society in which we live, which is vast inequality between people in terms of economics and the maybe overused word, but the reality of intersectionality of race, class, gender, discrimination, and racism itself. That said, I just want to speak to a few things that I would say have impact. Some things have already come out. And I look at that in the context of, as we rally around an extraordinary, important, transformative policy of establishing healthcare, Medicare for all across this country, so that we can at least live up to other, more well-to-do countries' counterparts around the world. Part of healthcare for all is healthcare for all with racism and gender discrimination, LGBTQ disability discrimination eliminated. Otherwise, it's an issue of, it may be healthcare for all, but if pregnant people are not listened to, if patients are not listened to when they share their concerns, or if they are so intimidated or put off that they don't access because they don't trust the system, it's not enough to have a Medicare for all a system available. It has to be available and completely accessible, completely free of racism and discrimination. That said, on top of that, we have to talk about the society in which we live and the policies that contribute to poor outcomes for Black women. It's just the statistics for Black maternal mortality have been shared here a couple of times, but I just want to say that maternal mortality and infant mortality are some of the most longest collected data in our data collection history as a country. So we know that over the last 100 years that infant mortality and maternal mortality data has been collected. It's been a wide gap between Black and white experiences. That's true for infant mortality, and that's true for maternal mortality. It's just that we've had an even wider gap grow before and during COVID. So some of this is COVID related in terms of maternal mortality, but it is not all COVID related, by no means. But the point is that gap has widened. While that gap has widened, let me just say something about what's our maternity health, what's our maternal child health policy and practice in the United States. So one of the things that stands out big when you look at the United States compared to the rest of the developed world is that this is the only well-to-do country with 0 required weeks of paid maternity leave for people who become pregnant. And let me give you some examples. So the United States has no required paid maternity leave. If a given employer wants to provide that, that's their prerogative or not. But there's nothing required in the law regarding paid maternity leave. Our neighbor to the north, Canada, the number of weeks of paid maternity leave is 51. Even New Zealand has 18 weeks of paid maternity leave. Germany, 58 weeks. In the country with the highest amount of paid maternity leave, and I want to emphasize paid maternity leave, is 91 weeks in Norway. So this is US comparison to 10 other countries. I just wanted to share that little snippet with you. Um, Similarly, as in terms of what I was saying before, these huge gaps of maternal mortality, growth of maternal mortality, as much as the African American experience is so out of whack compared to white counterparts, if maternal mortality has gotten worse for every race for which it's been collected. So in 2018, the data rose for all groups. 2019, the data rose for all groups. 2020, the data rose for all groups, and so on. It's just that the Black maternal mortality surpassed all, including regardless of education status or income status. The other thing I wanted to call attention to is the impact of not only Medicare, which I really appreciate previously being talked about, but Medicaid itself. Medicaid, as you know, is a shared responsibility program between the states and the federal government. And Medicaid, the states have a lot more discretion in terms of how and what level of resources they're going to put into. So it's not, as we know, it's not the same across the states. And we also know that with the Affordable Care Act element, there are at least 10 states still that have not expanded Medicaid. And the clustering of those 10 states, while they are not exclusively in the South, they are clustered in the South. There are some that are not. We also know that in those states that failed to expand Medicaid, the existing Medicaid program that they have, most of them have you really have to be destitute to access the program. And as was stated before, the program itself doesn't go long enough in terms of a person's eligibility. So when you think about postpartum depression and other kinds of issues that arise, maybe several weeks or months after a baby is delivered, some programs don't go far enough to cover those things. And it turns out that the states with the most draconian abortion laws and practices, with the most stingiest Medicaid programs, are also the states with the worst infant and maternal mortality, the worst health outcomes for their Black population in general. So we have to take all that into account. I also want to add one other thing before we open it up to discussion, and that is the whole issue of the criminal justice system and the role and impact of the growing number of people in prison and women in particular. So today there are just under 2 million people in prison. If you add to that, there are just under 5 million formerly incarcerated people. There are just under 20 million ever convicted of a felony. There are 79+ million people who have a criminal record, and over 113 million people have an immediate family member who has ever been to prison or jail. And within that context, we have to also take into account the growing impact and number of women in prison and jail. It's been a 742% increase of incarcerated women since 1980. 58% of all women in U.S. prisons are mothers. And of those in jail, 80% are mothers. There are still places where women are having babies shackled to a bed. There are still issues that Black women disproportionately face in terms of the child welfare system, other kinds of policy and practices that place such women in precarious and even dangerous positions in terms of childbirth. And I'm just giving a snippet for this particular meeting. There is an initiative that has been brought up. It does have Senate and House of Representatives sponsors, and that is the Black Maternal Health Momnibus Act. I want to just give you a summary of the issues that this act is designed to take care of. Naturally, as with many good pieces of legislation in Congress, it is sitting there, not being moved on with this present constitution of congressional actors. But I do want to list the 13 areas in this Black Maternal Health Momnibus Act that would be important, I think, for everyone to take into account. Number one is to make critical investments in social determinants of health. They mentioned in that under that umbrella, those that influence maternal health outcomes, such as housing, transportation, and nutrition. The second is to extend WIC eligibility in the postpartum and breastfeeding periods, provide funding to community-based organizations that are working to improve maternal health outcomes and promote equity, increase funding for programs to improve maternal health care for veterans, grow and diversify the perinatal workforce. That would include doulas and community health workers, lactation specialists, and I would add, pay them what they deserve. The sixth item on that bill is to improve data collection processes and quality measures so that we are keeping up with what actually is happening. Number 7 is to support moms with maternal mental health conditions and substance use disorders. Number 8 is to improve maternal health care and support for incarcerated mothers. Number 9 is to invest in digital tools to improve maternal health outcomes in underserved areas. That would include expanding telehealth and other kinds of practices that can promote access. Number 10, promote innovative payment models to incentivize high quality maternity care. And number 11, invest in federal programs to address maternal and infant health risks during public health emergency. Number 12, invest in community-based initiatives to reduce levels and exposure to climate change related risks for moms and babies. And 13 and last is to promote maternal vaccinations to protect the health of moms and babies. And that is, again, it is the Black Maternal Health Momnibus Act. Thanks so much, and I'd be happy to participate in any Q&A.